Every week I'm coming on with a home care report, home care trend. And I put in the title, "This is not 2012," is because I've been doing home care for over a decade, and it is totally different now. Totally different now. And when I tell you, the difference is significant due to the state of the economy. Understand? So I want to come on. This is for every business, not just for home care. When I started my home care agency in the early 2000s, it was easy to get clients. It was easy to retain clients. It was super easy to get caregivers. And today, caregivers are choosing to work independently more, and they are actually working with the client and taking out the agencies, which is they take out the middleman. So what does that mean? The clients are definitely more at risk by working with independent caregivers by themselves, but they also cut out the price factor of having an agency, which is cheaper for them. So what does that mean for us? That means that the more that clients seek independent caregivers, the less they will need home care agencies. Now, in the event of Medicare independent caregivers cannot take insurance, right? Also, that means we need to diversify ourselves digitally as well, like having all our systems set up digitally, making it easy for someone to pay. And then also, success loves speed. So if you get a client and it takes you 2 or 3 to 4 or 5 weeks to place a caregiver or a nurse, they're gonna go online and find their own caregiver now. So I said this is not 2012 because we have to really understand the state that the economy is in when doing business. Care is now a luxury. People going to the doctor is now a luxury, right? If I don't feel bad, I'm not going to the doctor. I'm not going to the doctor for maintenance. So what is going to set your business apart, home care or another business, apart from the next person? And why should I go with your service? Right? So we have to start understanding that it's going to take more work in order to retain and to get new clients and to keep employees as well. So back in 2012, when I first started home care, it was easy to open doors. It was easy to get clients, like left and right, private pay here, there, every phone's off the hook. Now the field is saturated. Understand, just like chiropractors, just like therapists, all kind of different fields where there is a saturation. But what will set you aside is branding, understanding and knowing how to brand yourself and how to niche yourself as a home care agency or a business owner or a healthcare entrepreneur. Actually understanding that it's going to take more than posting that I'm open. It's going to take a team. It's going to take you actually being and learning how to be a leader, right? So that's going to take personal development. We can't just get a business license and hire one person and say we're open anymore. No, because that family, when you sit down with that family, they're going to have 10 other agencies that are charging half the price of you. Why should I go with you? You're going to have power partners in the industry, such as hospice, home health, and different people that can vouch for your service and that puts your name in their mouth when they're in a room when you're not in a room, right? How can I do that and I'm brand new? Zach on here. I got to get back with you on the digital care option that you have. So just actually infusing technology into business, infusing technology into what you do is also a way to generate more business. But actually, really, like, we got an old school, like, door to door, guerrilla market now. We got a guerrilla market now. There's no way around it. We're competing with businesses who have trust funds. I'm talking about black-owned businesses. We're competing with people who have family members who can fund their entire company. We're competing with people who got it, right? So if you don't know how to be resourceful and you don't know how to network and you don't know how to, and your network is your net worth, period. So if you also don't do good business, you're not going to be open long, right? This is not 2012. Caregivers are employing themselves. They're taking travel contracts. You're secondary. They're door dashing. They're not taking care of people no more. They don't want to do it because they say we don't appreciate them. So what can we do as home care owners and business owners to bring these people back to the field and to take back our territory? That is a question that I wake up with every day. And I think that we have to look at the scene and understand the time that we're in. It is time to really understand that we cannot just open our doors, say we're open, create a flyer, and say, I'm taking patients. You have to really have a structure. You have to be enticing to an employee now, right? Why should I work with you versus over here when I got all these benefits and I get this and I got that, and you're not offering anything but $15, $10 an hour? They're not going to want to work for you. They're going to sign up, be on care.com. As soon as somebody on care.com hire them for $18, $15, $20, $18, then they're going to go work for them, and then they're going to no show on your client. How do we combat this? How? That is a question that I'm asking myself, but I want to be real and transparent about the industry and what's happening right now today. Today, it's hard to retain nurses. It's hard to retain caregivers. That puts us as home care agency owners in the corner. Even restaurants. Do you notice that the service is slower because they can't retain service? They can't retain cooks. Those low-level jobs, people are phasing out. They don't want to do them anymore. So they're figuring out ways to not work, living by a lower means, or they're doing independent contract work. DoorDash and Ubering. I took an Uber the other day, and the lady was like, "Oh yeah, I make $200 a day, and when I make $200, I just go home." So she's paying her bills off of Uber, right? Yeah, and offer more with your services. Yeah, offer more with your services. You're gonna have to power partner with other companies. This is also happening. We have private equity companies taking over smaller companies. So they're taking over large territories by buying out small business owners like me and you. I had a meeting with someone last year just to have the meeting, and they're taking over, and what they're doing, they're buying out all of these home care agencies in one area all over because they understand and know if they have the caregivers, they have the licenses, they can take over, right? And these are predominantly white companies. They don't really want us to do home care, right? So I just want you to understand the severity of the economy, and you have to be creative. You have to be resourceful, and it's not going to happen. You have to be as strategic as possible. My phone's gonna die, guys. I don't know why I always start my lives with this phone about to die. But I just wanted to come on here. That's my home care trend of the week that I feel people really need to understand and know that this is happening, especially people that are brand new. You really have to understand the severity of this in the state of the industry right now.